Madam Toastmaster, Mr. President, fellow Toastmasters and guests, good evening. My quest this evening is to speak for the next 5 to 7 minutes on depression in Ireland and depression in general. So, what is depression? What are the forms of depression? What causes depression? What can one do if they're feeling depressed? And what are the treatments available for depression? I researched this subject during the week, and from a Mediform journal I got the following definition for depression. It states if a person is considered to be depressed if they experience long-lasting feelings of sadness and hopelessness. They have unexplained aches and pains. They suffer from poor sleep, anxiety, lack of interest and energy. Often these feelings can be so severe that they affect the person's everyday life. So just move on to the forms of depression that depression can take. There are several, so a quick highlight of a few of them would be to start with PND, or postnatal depression. This is when a woman, following the birth of a child, has a depressive episode, and believe it or not, it affects up to 15% of women in Ireland today. The second one would be SAD, which is seasonal affective disorder. The main form this takes is lack of sunlight. So it affects a lot of people in the northern hemisphere, more so than here. But believe it or not, over the last few years, it's actually moving into Europe because of our poor summers. So the depression itself is known to disappear during spring and summer because of the sunlight. Then we have psychotic depression. Psychotic depression is a depressive episode, but the patient themselves suffers hallucinations, delusions, and often can't tell reality from imagination. Another form of depression is bipolar disorder. This was more previously known as manic depressive, and this is when the patient experiences movements of very highs and very lows. Dystigmic or dysthymia is also a form of depression, and this again, the patient suffers long periods of depressive episodes. They can be a couple of years or many years. They can be once off or reoccurring. And finally, people can suffer a major depressive disorder, which is also known as major depression. This is where a patient has a combination of symptoms that affect their daily life, whether it be their study, their work, or just getting out of bed in the morning. So on this display here this evening, I just wanted to show you, there's a couple of charts I was able to print off, so you may have a look at them later other than getting into them. There's the prevalence of depression by age just grouped in, where we have Europe as a whole, the amount of people that are suffering from the various depressions, and just over on this page here, if I can open the page, just a society that is available for depression, which I'll touch on in a moment, and just a picture by itself that may speak 1,000 words. What causes depression? Well, as with everyday feelings, sometimes there's no obvious reason for depression, but it could be as simple as someone walking along the street and being mugged. It could be in the current economic climate that you're suffering a job loss, or the birth of a child that I mentioned earlier, or a relationship breakdown, or even financial pressures or trying to pay the mortgage in the current recession. These are environmental effects that affect depression, and because of the environment, these are called reactive depression. But sometimes it's not just as simple as that. There is some unknown reason, and this can be biological or genetic in nature. So, what can one do if they are feeling depressed? Well, there are several things, and just keeping it very generic. First of all, you can speak to a GP, speak to a friend, exercise, because exercise, as we know, stimulates the mind and releases endorphins to change the mood and perhaps boost a person up. You could challenge positive thoughts. And what that means is you simply try and change the negativity into a positivity and get the mind into changing these thoughts into more positive. Avoid alcohol in excessive amounts and drugs. And believe it or not, sleep, because sleep itself has restorative action for both the body and the mind. If you know yourself the underlying issues of the cause of why you're feeling depressed, perhaps if you could tackle that yourself. But again, this is different for every patient, so we're again keeping it very generic. I'd like to just tell you a few treatments that are available for depression. There are many self-help books, and the Americans, as we know, are all into self-help books. So there's books and leaflets, and there's various programs, etc. There's talking therapies. Now, talking therapies will be for someone apparently with very mild depression. There's counselling, where you can speak to an actual counsellor one-to-one, and he helps the patient see things from a different perspective. There's support groups such as Aware, which I have up here, a great Irish organisation, and antidepressant medication. So, just to reiterate on a couple of things to finish off, I have informed you what depression is, what forms depression can take, what a person can do if they're feeling depressed, some treatments that are available for depression. Many of you this evening may not know, but this is actually World Mental Health Week. So I thought this topic was quite appropriate for this evening, and that's why I chose to talk about it. Also, just to finish off, sometimes, just as you have done here for the last 5 to 7 minutes, just listen. Listen to a person. And you know what? It could be all the therapy they need. Madam Toastmaster, Mr. President, fellow Toastmasters, thank you.